a gigantic number for any profession, but especially in a profession where we keep saying where we have shortage. It's extremely worrisome.
For every 100 nurses in Quebec, 43 are leaving the profession before they turn 35. That's according to a new report from research think tank the Montreal Economic Institute. Quebec ranked 5th in Canada with 43.1 young nurses leaving for every 100 entering in 2022, 29% higher than in 2013. Some of the reasons cited to the MEI were a lack of control over their work schedules, including mandatory overtime and a lack of shift flexibility.
Just because it came from an organization that's not nursing, that possibly politicians will listen to it more. But we have been saying this for years now.
The report also found that nurses that wanted to quit were also more likely to express interest in working for an independent nursing agency, like Melanie Boulerice, who owns Nomadic Nurse Agency.
I had to think of a quality of life I needed to create for myself, and while doing the job that I still love. We can talk about how, well, why don't we just leave the profession? I'm not going to lie. There's times that I've thought about that. I've seen us lose nurses to Costco and Starbucks, because the salary makes more sense and the benefits make more sense with the labor of work that we're doing. It doesn't make sense that our salaries cannot reflect a proper the job that we're doing.
For nurses who received their licenses after December 2022, their salary starts at the lowest pay scale regardless of education level, compared to the past when those with university degrees would be paid more.
That's definitely a factor contributing to why a nurse would leave the profession, because it's not giving you room for growth within the profession and being compensated for that growth.
Nurses also say the ability to provide optimal care has deteriorated.
There's a lot of risks that you encounter, whether it's potential unsafe work conditions, staff to patient ratios. These are things that puts your well-being and your license on the line every day. So it's a very high risk environment and profession.
This comes as the FIC Nurses Union has been without a contract for over 500 days, and their 80,000 members will vote on the conciliator's proposed collective agreement in mid-October.
Everything seems to be based on seniority, and for new nurses, that's really scary because it doesn't provide us with a lot of stability in our workplace. I think that would be a big deterrent for new nurses to want to sign on to this collective agreement.
Nurses have a good reason to leave, and so we need to give them good reasons to stay.
In Montreal, Alyssia Rubertucci, City News.